Okay. Entric fever. Please don't talk. Be serious, at least in the class. Do not come here to chit chat or enteric fever is caused by everybody. Enteric fever is caused by Salmonella typhi, Salmonella paratyphi A, and Salmonella paratyphi B. The source of infection is patient or patient who is recovering. Convalescent, carrier. Convalescent, carrier. Man get infected by fecal-oral route. Fecal fecal-oral route. Man get infected through fecal-oral route. Infection occurs by eating food or drinking water contaminated with Salmonella typhi para A and para B. Okay, that's a very important. We should know the route of infection. So you should mention about carriers here. Carriers, special Typhoid Mary. Her name was Mary Mellon. She was famous cook in the New York. She was very passionate about cooking. Fortunately or unfortunately, used to get employed in the hospitals, used to kill doctors. Almost she has infected 1,300 cases and she was imprisoned. She escaped and contested in the court of law. And at the age of 74, she died of myocardial infarction, not typhoid fever. So you should remember about carrier status. Carrier is defined as the person who carries microorganism without suffering from it. Everybody. Carrier is defined as person who carries microorganism without suffering from it. So there are convalescent carrier who is recovering from infection, temporary carrier less than 3 months, chronic carriers more than 3 months, and paradoxical carrier, a carrier acquiring from another carrier. So all infectious diseases, there is a carrier status. In all infectious diseases, there is carrier status. So what happens when it enters the intestine? Especially we should be very careful in eating outside, especially uncooked food. Cooked food you eat, bhajia, garam bhajia. This uncooked like the pani puri, bhel puri. Even we have discovered when I am doing post fashion, we went to the best of the ice cream stalls. We recovered Salmonella typhi from ice creams. One of the best top end ice cream stalls in Bangalore. At that time, it was some Lakeview ice cream or something like that. There was no lake, but name was Lakeview ice cream. So all cold items you should try to avoid eating in the roadside eateries, especially pani puri. Pani puri is a rich source. And another thing is ganne ka ras. Ganne ka ras in Telugu is what? Sugar cane juice. Sugar cane juice in Telugu? Whatever it is. So that's a rich source of typhoid fever and even infective hepatitis. So you see a lot of that vending machine. You see a lot of houseflies playing musical round, chair around, and you do this like this and drink. Especially in summer, infective hepatitis A, all fecal and especially pani puri. During COVID, they used to nicely wash their hands. After COVID, they will put their sweat and everything in the pani puri and make you eat it. It is very tasty. Pani puri is very tasty. So once man get infected, So it enters the intestine and multiply in the Peyer's patches, and it will not, although it gets phagocytosed, but it resists everybody. It resists intracellular killing by macrophages and phagocytes. In fact, they use these cells as a vehicle, and through thoracic Peyer's patches, they multiply, and sometimes there is a hemorrhage, perforation and hemorrhage. People die because, why I am telling you this, uh, you should be very, very careful about roadside eateries. Find a good place to eat always. There is a lot of talks about how to maintain good food hygiene. In fact, where I was earlier working, place called Wayanad, we used to call all the healthcare workers and give them how to keep the food clean. Okay, how to wear full length apron and all those things. If you ask for a glass of water, we'll put five fingers in five glasses. We'll put it like this. So in one you'll have fungi, and you'll have one parasite, one will have bacteria, one will have virus. Then afterwards they'll do like this. Yeah, what do you want? This is very common. Okay. So especially the food hygiene is very lacking in Indian subcontinent because we are overcrowded and a very poor country. Of course, now things are improving. Especially roadside eateries, you should avoid as far as possible. As long as you are taking, a lot of students miss their internal examination because they develop infective hepatitis. Just before examination, it occurs during summers in Bangalore most of the time. You used to get severe infective hepatitis. So it's very, very common. I was also very fond in during my residency. I was in Mumbai. I went to Zoo Beach, to go to Mumbai, Chowpatty Zoo Beach, very famous beach. They make a lot of tasty pani puris. I ate 8 plates of pani puri. Next day I had developed infective hepatitis, very severe diarrhea and all those things. After 1 week time, I had a bilirubin going up to 7, SGOT, SGPT going up to 2,500, 2,800. I was admitted for almost 1 month to recover from infective hepatitis. So whenever you are eating outside, keep an eye on food hygiene. So fingers are very bad transmitter of microorganism. So one bacteria, microorganism at fingertip, bacteria, virus, parasite, fungi, everything. You will say bacteria at my fingertips. So you should be very careful, and you should wash your hands every time, and look at the place where a lot of people in Bangalore, they eat, there is carts, in that they make idli, vada, uh, a lot of things. They are very tasty, but a lot of my friends who come from US, so they like to taste that, but next day develop diarrhea. Immediately within 48 to 72 hours, they develop diarrhea. So very careful about this. And through Peyer's patches, it goes to through thoracic duct, it goes to blood. Early there will be bacteremia followed by toxemia. The microorganism gets seeded in various organs of the body. It goes to brain, it goes to kidneys, it goes to bones, it goes to spleen. There will be hepatosplenomegaly. So because of improvement in we are getting in most of the houses there are toilets, good water. Because when I was studying MBBS, there was no Bisleri water or Kinleys or anything like that. So drink water like that. And nowadays, with a lot of reverse osmosis, filter water, everything has come. Now you can the infective. I mean, all the infection that is occurring by fecal oral has come down. In fact, it has totally. If you advise all your family members about food hygiene, where to go and what to eat and how to eat. Okay? So it is very, very important, and you should especially Look at the server, the cloths he's wearing, and how his fingers will be so big with nails and all those things. He'll be scratching like this, and all those things. So you should be very careful when you're rating in certain. So once a man get infected with typhoid fever, I said the clinical symptoms are clinical symptoms are anorexia, nausea, sometimes vomiting, rose spot. Very important is bradycardia. And what you answer it is a sign. Hepatosplenomegaly. Hepatosplenomegaly. Then coated tongue and stepladder type of fever. Stepladder type of fever. These all things happens in case of typhoid fever. Okay. You have to diagnose. Fever is very difficult. Anything goes wrong, you will get fever. Fever is defined as non-specific defense mechanism. Like what you have non-steroidal anti-inflammatory drug in pharmacology, it is a non-specific. In fact, I must have told you already. In olden days, when penicillin was not discovered, they used to inject malarial parasite to kill the Treponema pallidum before the discovery of penicillin. So anything goes wrong with your body, they give. First thing to alert is. So now we'll have an act on ATCOM module. Please come. You are a doctor. Sit there in the chair, and you be patient. Take the. Want to take the chair or stool? Want to be comfortable? Stool will be okay. Can take the chair also, no problem. Okay, okay. So sit down. So not what all the history you'll ask for the yes, you complain. You got a fever, not feeling well. You got myalgia, body ache, fever, and couple of days you are not feeling well, and you got a nausea, vomiting sensation, everything. And somehow I'm not happy. I've taken Dolo 650 for 3 times. I'm not happy. What I'm doing? Tell it. Little louder. Everybody should listen. Shall I give my mic? Take this. Yeah.
I was having fever for the last 3 days. It was so bad. I took these tablets of the so I still have a fever.
You don't have any other thing to tell him? So what all questions you will ask?
When the pain started. When the pain started.
Not pain, fever. There is a difference between pain and fever.
Yes.
You know what is labor pain? What is labor pain? Yeah. Labor pain is very bad. You experienced? You can't experience it unless you go uterus. Now everybody is. You must have heard males undergoing uterus transplantation and implanting embryos and delivering to have the feel of womanhood. And you must have heard Karan Johar, Shah Rukh Khan. Everybody is undergoing what is called as IVFBT, in vitro fertilization, for the block 2. To tell you will not believe, my thesis topic was anti-sperm antibodies. Way back in '84, I did my dissertation. I went to institution research in Mumbai. First baby was born by Inder Hinduja. I was a part of the team. So now it has become a hut industry. So every third, fourth place is infertility center, and India has become a hub for the surrogacy. They hire a woman whom must have seen a movie called Mimi. Okay, they hire a woman. Husband and wife will come. The husband will donate sperm, wife will donate the ovum, and after 9 months, they enjoy holidays in uh, India and take out baby while going back. So they choose the color of the baby. It's become a ready-made industry now. You can choose the tie color, eyebrow color, everything. So still we do not have ICMR written guidelines about this in IVF program and all those things. Now, institution of marriage is something very shaky now. So everybody is empowered with a lot of money, and all girls are educated. You see the population, this and this. A lot of girls are going to get more and more educated, more and more empowered. It is difficult to maintain a balance. The ego problem will lot of ending up with divorce and all those things. Not telling that we should have a good married life. So continue it. Pain and labor pain is different. Okay, sorry.
Since when you are
Duration of the fever, 4 days. Okay.
real problem, vomiting,
No, to change the diagnosis, you should ask for the throat pain. Throat pain that clinches you upper respiratory tract. Cough with expectoration that gives respiratory infection. Burning micturition, urgency, frequency that gives you an idea of urinary tract infection. Loose motion that gives you an idea of GI infection. So other than this, if you have this, then we have to go in for that is called pyrexia of unknown origin. There is also called a FUU, fever of unknown origin. So all this you don't have. You just say I am having a fever which is touching 103. When I take some dolo, it comes down but never touches normal. I don't feel normal. I'm having a problem. I'm not very comfortable with all the medications, all those things. Then we proceed. What are the now you have to go for history of smoking, border and blood and bowel habits, and history of diabetes, hypertension, and you have to take the pulse. You have to look for the bradycardia, take the blood pressure, and look for the tongue, and look for the rose spots on his body, and palpate the abdomen, look for the hepatosplenomegaly. All these things you have to look for that. Now, in spite of all these things, if you see hepatosplenomegaly and rose spots, that gives you an idea that person is suffering from enteric fever. Please go back. So all this after that, one more history you did not ask: history of alcohol. How do you ask history of alcohol?
any habits. We have any habits of any
Habits. So many habits you will have. Alcohol habit particularly. How do you ask? It happened with me in the past. Do you drink? Patient said yes. I drink in the morning. I drink in the afternoon. I drink in the night. And sir, my consultant came. Patient is alcohol. He drinks in the morning, in the afternoon, drinks in the night. And he asked, "What do you drink?" Sir, I drink milk, not alcohol. So you have to be good communicator. Pedagogy. Doctor means pedagogy. Pedagogy means good communicator. Okay, that's very important. How you communicate with the patient, that's very important. So now your goes in the diagnosis of pyrexia of unknown origin, FUO, pyrexia of unknown origin. Most likely case of enteric fever. So diagnosis of enteric fever is done by blood culture, second week, serodiagnosis. Third week, stool and urine culture. Stool and urine culture. Everybody repeat. First week, blood culture. Second week, serodiagnosis, Vidal test. Vidal test. Third week, you have to do stool and urine culture. Third week, you have to do stool and urine culture. Urine culture. So basically, this is a gram-negative bacilli. The gram-negative bacilli. This is a flagellar antigen. Flagellar antigen is H. Somatic antigen, body antigen is O. Somatic antigen is O. So it is motile with peritrachate flagella. It is motile with peritrachate flagella. How do you do blood culture? Blood culture, patient, you have to collect 1:10 because there will be intermittent ratio. There is a blood culture bottle. Brain heart infusion broth. There is a blood culture bottle called brain heart infusion broth. Blood culture bottle called brain heart infusion broth. Earlier we used to do two separate bottles. In case of cocci, subacute bacterial endocarditis, we used to use glucositrate broth, GCB, glucositrate broth or bile broth for entric fever. Nowadays, we use brain heart infusion broth for both. So once it comes to the laboratory, it is incubated at 37 degrees for 24 to 48 hours. 24 to 48 hours in the incubator. And if there is any growth, you can visualize the growth, the blood culture board. It is subcultured. It is subcultured onto McConkey and blood agar. This is primary, secondary, tertiary. This is McConkey medium. This is blood agar. This is McConkey medium. This is blood agar. Okay. Once you see the growth in the blood culture bottle, you subculture onto McConkey's medium. In McConkey's, it shows NLF colonies. Non-lactose fermenting colonies. Non-lactose fermentings are pale or colorless colonies. Non-lactose fermentings are pink colored colonies. Example of lactose fermenters are E. coli and Klebsiella. Example of non-lactose fermenters are Salmonella, Shigella, Proteus, Pseudomonas, Vibrio cholera. Salmonella, Shigella, Proteus, Pseudomonas and Vibrio cholera. Lactose fermenters are E. coli and Klebsiella. They produce pink colored colonies. So once you get the colony growth, NLF colonies, you have to do the smear from the colony and look for gram-negative bacilli. So there are so many gram-negative bacilli that infect the blood. Then you have to do biochemical reaction. Biochemical reaction. So first biochemical reaction is we put TSI. It dispensed in butt and slant. It is dispensed in. As I said, all the Enterobacteria ferment glucose with acid and gas. So this Salmonella typhi produces speck of very small amount of H2S. It will not, the slant will not be changed, no color change. This is called alkaline slant acid butt. Alkaline slant acid butt. Paratyphi A is anaerogenic, it will not produce any. And paratyphi B produces abundant carbon hydrogen sulfide. Paratyphi produces, B produces abundant hydrogen sulfide. Then you look for mannitol motility medium, it shows zigzag motif, it is motile. And you grow on citrate medium, cement citrate medium, it is citrate positive. So after this, all this biochemical reaction, we have to finally confirm it is S typhi only. We have serum, specific anti-serum against S typhi. Make saline suspension of S typhi on the slide. Add specific anti-serum. There will be clumping of the organism. That clinches the diagnosis. It is Salmonella typhi. So now we have to report it to the clinician. But important, what clinician wants is not bothered about what organism you isolated. He wants antibiogram, antibiotic sensitivity. So you take the organism, put it in peptone water. After 1.5 hours, we make with a swab. We make tennis lawn culture. Lawn culture. It is called as lawn culture. And we have antibiotic impregnated discs. For example, chloramphenicol, nitrofurantoin, then ciprofloxacin, ceftriaxone, ceftazidime, augmentin, erythromycin, all those things. Then incubate this inoculated plate with antibiotic discs overnight and look for the zone of inhibition. Zone of inhibition. We measure the zone of inhibition with scale. We have one chart called Kibri-Bayer's chart. We have a chart called Kibri-Bayer chart. Depending on that, we give whether the organism is resistant or sensitive to the organism. So, in the report goes as Salmonella typhi isolated in the blood culture, sensitive to so many antibiotics, resistant to so many organisms. That is the final report. So, coming to the Vidal test, this is the first agglutination test done. Nowadays, it's very people are very fond of asking this question, even in your entrance examination. But it has lost its value now. Now, in Vidal test, we are testing the antibodies. Against Salmonella typhi, para A, para A, para B. So we put TO, TH, we don't put AH, we put AH and BH. Because we don't put BO and AO and BO because antigenically they are similar. Antigenically they are similar. So we can do it on slide. It's called slide agglutination test. You can do it on the tube. That is called tube agglutination. Now, blood culture and urine culture, stool culture, urine culture use enrichment media. What are enrichment media? Enrichment media. Example of enrichment media. Enrichment media. What are enrichment media? Enrichment media. Hold like this. Everybody hold like this. In the intestine, there is a commensal called Escherichia coli. Enrichment medias are all liquid medias. They inhibit, hold like this, everybody. They inhibit the growth of Escherichia coli and enhance the growth of Salmonella typhi. So we use enrichment media which will inhibit the growth of E. coli and enhance the growth of Salmonella typhi. Then special medias are used are Wilson and Blair bismuth sulfate agar. Wilson and Blair's bismuth sulfate agar. Wilson and Blair bismuth sulfate agar. Sulfate is converted into sulfite. Sulfate is converted into sulfite. The colonies are black in color. Sulfate is converted into sulfite. The colonies are black in color. Then we use Salmonella Shigella agar, XLD agar, desoxycholate agar, DC agar. These are all selective media, highly selective media for growing Salmonella from the feces. Now coming to the treatment part, now the Salmonella has become MDR, multi-drug resistance. No antibiotic works against it because I already told you there's a lot of antibiotic being used in veterinary practice. So we are exposed to the antibiotics day in and day out. When you take egg, milk, any poultry meat, any poultry product, the E. coli in the intestine gets gene which is resistant to so many antibiotics. When the Salmonella infects the intestine, there is a conjugation between E. coli and Salmonella typhi. All the drug-resistant genes are transmitted through conjugation. So Salmonella typhi becomes resistant to multi-drugs. So we should be very careful in selecting the antibiotic and follow the antibiogram which is given by the microbiologist. So we should not unnecessarily use high-end antibiotics like meropenem, imipenem, ticoplanin, and all those drugs should be used. Still, the drug of choice remains to be cyclin or nitrofurantoin or cotrimoxazole. But most commonly, it is ceftriaxone is being used for the treatment of enteric fever. Now, prevention and prophylaxis. In olden days, we used to take what is called as TABC vaccine, TAB plus cholera vaccine. T for typhoid, A for para A, B for para B, and C for cholera. So it was a very painful intramuscular injection. People used to develop abscess, injection abscess because of the TABC vaccine. Now a newer vaccine come, that is Typhoid Mary vaccine. If you take that vaccine, you are immune for 3 years. Typhoid Mary vaccine has come, which is very good. And once you take that, and there is one vaccine, streptomycin SY21. Typhorol, oral typhoid vaccine. So you have to swallow every year 3 typhorols in the morning in empty stomach. You are immunized for 1 year. The new vaccines against typhoid are typhorol and Typhoid Mary. So again, coming to the prevention of typhoid fever in the general population, again community people will come into the play. How to keep Swachh Bharat Abhiyan, Atmanirbhar Bharat. So you have to wash your hands before eating food, and you should keep your kitchen clean, and all the people who are working in the kitchen should be screened for HIV, typhoid carrier status, and you should keep the you should interview the cook before employing her in the hostel mess, and all these things have to be done. Otherwise, all the students in the hostel will become victim of typhoid fever. We had a breakout of typhoid fever earlier when we were working in Wayanad Medical College. Nearly 110 students suffered from entric fever. Finally, we found out the cook who was cooking this, she was a typhoid carrier. Isolated typhoid bacilli from both urine and feces of her. So we should be very careful. For carrier status, we do via agglutination test. There is one more agglutination, lipopolysaccharide antigen, via antigen test. Titer of more than 1 in 10 is diagnostic of carrier status. Or you can pick up the OGD, uh, the endoscopic aspiration from the gallbladder and stool culture, and find out the carrier state of the person. That's very, very important in the prevention of the typhoid fever. So move to the practical hall. You will divide yourself into 3 batches. We'll show all the medias and the biochemical reactions that are used for the diagnosis of fever. That will be kept in your examination as a applied exercise. Thank you.